On today's episode of Plastic Surgery Uncensored, we're actually going to do a deep dive into patient Julie's actual journey, where we're going to touch on 3 interesting topics: autoimmune disease, the psychology of separation and when you have big changes in your life, and the aging process, what to do when. So that's a lot to cover in one lady's journey. So please listen to Plastic Surgery Uncensored. So on today's, I guess we're going to call it episode?
Yeah.
Okay, because I get excited on today's podcast show.
We'll just keep morphing it.
Yeah, we'll just
every
keep
time it'll be something different.
Well, because
today's party.
Yeah, well, I was just going to say it's so personal, and today's extra special personal because we have a patient who we're going to call Julie, because we actually, can I just reveal that names have been changed to protect the innocent?
Yes. Well, patient confidentiality in general.
100%.
100% important, but the journey is more important. And we're so lucky because this is not just a patient. This is a friend of mine now,
Correct.
I really love my patients, all of my patients, but every so often a certain patient will come through, and the inevitability is that you have a better and closer connection. And so Julie and I have had a long sort of journey together, and I'm so lucky that she has agreed to come and share her journey, because there's a vulnerability associated with that.
Sure.
And I think through our dialogue today, I'm super excited because we're going to hit on 3 crucial topics in the world of plastic surgery.
They're hot buttons.
You talked about them. And one of them is going to be the whole concept of autoimmune disease like lupus and the saline silicone debate. Mm-hmm. We're going to talk about the aging process, because there's certain points where people sort of throw in the towel like, oh, I'm too old to have to worry about this, particularly when it comes to their bodies. And third, we're going to talk about what happens when an individual is going through the unfortunate process of separating and the emotional effects and what you go. So
parenthetical aside, Julie has an amazing body. Parenthetical
and I will
aside.
tell you something.
Thank you.
I had nothing to do with it. All I did with Julie, she was gorgeous before and she's gorgeous now. She's always been in shape. She's always been fit. And all I did was just the icing, just a slight tweak to...
How many years have you guys known each other?
How long has it been?
Oh, God. I would say, 10 years?
Yeah, has it been 10 years, this whole process?
9, 10 years.
Yeah, something like that. So, well, welcome. So
Thank you.
Thank you for coming.
Thank you. It's my pleasure. So I would say, what I really want to say first is you're never too old.
How old are you?
Age is just a number.
Let's start with that. How old?
I'm 63.
What?
Right.
Yes. And age is just a number. So I was always in shape. And let's start with my nose. I have lupus, and I always had a problem breathing. I thought it was from my lupus. That's what my doctors would tell me. And then my rheumatologist he said, I don't really think everything should be blamed on your lupus. I feel you have a problem with your nose. He sent me to an ear, nose, and throat, who then told me you have a deviated septum.
Right. So let's stop there, because I think that's a huge issue right there. So what is deviated septum? What's this whole breathing thing? So what happens is, and I really want to touch on this because it's like there's, as Monique knows, there's buzzwords in plastic surgery, and
Sure.
deviated septum is one of them. So deviated septum means that the cartilage in between the right side and left side of your nose, which is if you stick your finger in your nose, you can feel the wall in between the left and right side, is somewhat crooked. Now, in and of itself, that is meaningless. Why? Because 100% of people have a crooked septum. There's nothing in your body that you have that's straight and balanced and symmetrical. The issue is, how crooked is it, and does it or does it not impact your breathing? In other words, you can have a deviated septum, meaning it's not straight, and breathe perfectly fine. You can have a deviated septum and it's so crooked and or in the way that it affects your breathing. So in your instance, the deviation was significant enough where it impacted your breathing, correct?
Correct.
So then you saw the ENT.
I saw the ENT, who told me I did, in fact, have a badly deviated septum. I chose to not have the DNT take care of my nose.
Why?
I just felt that I wanted a
Plastic surgeon.
plastic surgeon, thank you very much, to take care of my nose.
So let's stop there. So what is ENT? What's plastic surgeon? What are all these names? So ENT obviously is ear, nose, and throat, which is a specialty, and a phenomenal specialty, and they deal with the ears, the nose, and the throat. And so they are very skilled and very trained, and they take care of sinuses, they take care of deviated septums, they take care of turbinates, they take care of all those kinds of things. When those surgeons go on to further training, they learn the cosmetics of the face. So, the issue at hand, let's talk about that, is there's two parts to your nose, right? There's the functional part and there's the aesthetic part. The functional part is your nose is there for one reason and one reason only, to breathe. That's what it's there for. It's to humidify air, stop things from getting inside your nose like dust and pollen, and it's there for breathing. The cosmetic part is the part of our modern day world, which is, God, my nose works fine or doesn't, but it's ugly, or I don't like it, or I wish it were smaller or more refined. So the issue is that usually the philosophy is that if you have a functional problem, you go to your ENT, your ear, nose, and throat. Your allergist sends you to the ENT and so on and so forth. The philosophy is you got to breathe. If you have a cosmetic issue, my nose is big or it's bulbous or whatever, you go to a plastic surgeon. So what do you do when you got both problems, which in reality is probably most patients? And so what you need to do is you need to find somebody who's skilled in both. And I think what you were alluding to is that you didn't feel that from a cosmetic standpoint, probably, this ENT was probably the best person to handle your nose, because we all know people who went to go get their deviated septum fixed. And oh, by the way, while you're there, can you just make my nose look a little bit better, like some afterthought? And then their nose looks ugly and maybe it breathes better, maybe it doesn't, but it's ugly.
Correct.
Right? Is that what you were alluding?
Exactly. I was afraid that it would look worse than it did. I had an Italian nose.
You're kidding me. You're Italian? Italian nose.
Yeah. So I felt it was a little too big. And I also just felt I would have more trust in a cosmetic surgeon.
Okay. So the truth is that most plastic surgeons don't do a lot of breathing work. So the problem that the patients who go to cosmetic surgeons or plastic surgeons, we don't use the word cosmetic here. It's because
he gets really upset.
Yeah. We use plastic surgeons.
Plastic surgeon.
Yeah, because cosmetic surgeons can be, your dentist can be a cosmetic surgeon.
Okay.
Plastic surgeons is that most plastic surgeons really focus on the aesthetics. I happen, as you know, noses are my
bailiwick.
They're my baby, right?
Yes.
I do everything, and I do everything and anything that I do, I feel like I do well, or I wouldn't do it. But noses are my little baby, and I do aesthetic rhinoplasty in conjunction with functional rhinoplasty at its highest level. And in general, if you're out there doing your nose, you want to find somebody who's going to specialize, not just it's cosmetically looks awesome. I can't really breathe, but who gives a crap? It looks good. Or I breathe really amazing and my nose is not so pretty. You want to find the guy who does both, because that's really, you shouldn't be doing one or the other.
Exactly.
So you came in, and so keep going on your journey.
So I came in, and fortunately, when I saw Dr. Aban, who is you, I did my consult and immediately felt comfortable. Dr. Aban checked me, and I came in with a girlfriend, and my girlfriend also wanted to have her nose done, but just for purposes of having her nose look better, did not have a deviated septum. And Dr. Aban told her she did not need her nose done. Her nose was perfect.
Yeah, I don't recall her, but I'm sure.
Yeah, she totally disagreed. She wanted it done. He told her it was not a good idea. It would not come out right. She can go somewhere else. They would do her nose, but he told her, please don't have it done. She went ahead.
Oh, really? This is all news to me. I love this information.
Me too.
Had
I'm
it
excited.
done
I'm
somewhere
salivating right
else and regretted it big time.
Is that right?
Yes.
You have an "I told you so" in your pocket now.
Yes. Definite
the
"I
number
told you so"
of "I told you so" is astronomical. It's sad. It's gratifying, because it makes me feel good that I have only money to be made, right? I mean, I have a business here. Why the hell would I ever turn in? I mean, this is an expensive rent. I'm in Beverly Hills. So nothing makes me feel sadder that when people don't listen to heed my warning. But at the same time, internally, I'm feeling like, okay, well, at least I'm doing the right thing. So
exactly.
So tell me, because what makes it, why is she unhappy? Because she was like hell set on getting it done.
Yes. Well, the doctor who did it, which will remain nameless, did it, and it came out so small from day one.
Right.
Which, as we know, will only get smaller.
Correct. You see, my patients are so educated.
Yes.
Yeah.
She understands the concept that whatever your nose looks like within the first 6 months is only the beginning of shrinkage.
Because it's swollen a little bit.
Oh, it's more than swollen. It looks like a sausage. So if it looks amazing at 6 months, you're dead. Because in 6 years, it's going to look like nothing more than a pencil.
See, I learned skeletonized today.
Yeah.
I never heard skeletonized.
Oh, I never did either.
Yeah, well,
a new
it's a
one.
medical term for pencil nose. But yeah.
Well,
At least we're staying with pencil nose.
so that was a disaster.
Yeah.
Needless to say.
Okay.
My nose came out amazing, and
you
my
look good.
breathing is
It did.
spectacular. I never knew I couldn't breathe.
So that's actually a funny thing because like most of the patients I get are for cosmetic purposes, right? They come in, I don't like my nose. I'll look inside their nose and I'm always telling them your breathing is mediocre because in reality, most patients are. And the thing is, you don't know what you don't know till you know it. And you don't know what your breathing is because you only know that.
It's like eyesight.
And you only know it because it's a point of relativeness. So my breathing it's good, I guess. And then if I go, wow, then I'm like, holy crap, you know what? My breathing wasn't all that good. So I fix everyone's breathing when they come in for a rhinoplasty. And the reason being is twofold. One is, why the hell wouldn't you want to breathe better? And the other is when you'd get a cosmetic rhinoplasty, essentially what are you doing? You're making the nose smaller. One way or the other, you're making it smaller. Now, you should never make it petite. And if you look at her nose, it's anything.
No, it's gorgeous.
But you should it's going to be smaller. So if your breathing was average before we do the work, and cosmetically it's smaller, would you suspect your breathing would be better, the same, or worse if all we do is make your nose 25% smaller?
Trick question.
Right.
So it's going to be worse.
Yeah.
So if you don't address breathing, even if the patient says, no, my breathing is fine, they're going to have poor breathing. So we fix it anyways. And then they're like,
And how do you fix it?
well, we got to fix the septum.
Okay.
So the septum, what does that mean? Well, the septum's crooked and parts of it kind of like stick out into the airway. So think about the airway as like a passage,
Right.
Air is going in and out of that passage. If one of the walls of the passage sticks out too far, it makes the passage smaller.
Right.
So what we do is in the areas where the cartilage bulge in and out, we take that portion out. The parts that we leave behind for support, if it's crooked, we straighten. And on the other wall is a bunch of things called turbinates, and they're nothing more than humidifiers. They're balls that kind of stick out of the walls, and they humidify the air. Well, in many people who live in metropolitan cities and have horses and dogs and cats, those turbinates get swollen, and so we shrink those. So the net effect is that the wall is straighter and the turbinates are smaller. And oh wow, I can breathe better. So that's how we do to straighten out the nose. So your breathing is better.
Amazing. I can't believe it.
And your nose looks beautiful.
It does.
And everyone is shocked if I tell them that I had my nose
it
done.
looks real. See, you could have lied to me, and I would have believed you. I would have just
because
thought you were born with a
because
beautiful
her nose
nose.
is
There's not
it's
one
not
mark.
small.
And no marks anywhere.
I mean, she's healed beautifully. It's got relative size to it. It's balanced, and it's, arguably it's like her old nose, but perhaps slightly better or cleaner and more symmetric, right?
It's gorgeous.
Yes, definitely.
So so then what we're gonna do is we're gonna talk about real quick. Let's talk about. So we did your nose. Is there anything else about your nose experience that you think is?
I have a question. Well, the whole segment started with her saying that her rheumatoid doctor, did I get that right? Rheumatologist?
Yes, my rheumatologist.
So she's going in for surgery with autoimmune disease, and we haven't even talked about
Right.
it.
Well, we're going to talk about the autoimmune disease because I think it's really important. Is when I saw you in follow-up. And as you know, I follow up my patients for years. And in one of our visits, you came back and you were walking in with a walker.
Yes.
When I mean walker, I'm not talking about some like I'm talking, she was moving like 1 mile an hour. Mm-hmm. Someone as if she had either had hip replacement or she was 100 years old. And this was like probably a year or two after you had done your nose. So what happened? What's going on there?
It was about 2 years later. And I honestly don't know what happened. My lupus flared extremely bad. They couldn't control it. They tried so many different medications.
Like steroids?
Steroids, which I wound up having an allergic reaction to the steroids, which is very unusual.
Which is unheard of because
Yes.
we give any allergic reaction you have, we give you steroids.
You give steroids.
So that's a bad sign.
And they tried different ways. They tried putting steroid patches, and I blew up wherever they put the patch. They didn't know what to do for me. They tried different medications that were not even approved. They were trying everything just to prevent it from going to my organs.
And so what was happening to you what were you feeling?
Symptom-wise, I had pain throughout my whole body. I couldn't even make a sandwich or hold a fork. I was being fed.
When I saw her, I mean, it was amazing. Like,
I was bedridden.
She was bedridden. I mean, literally, when I saw her, she was like, I finally got out of bed.
Yeah. When you saw me, I was better because I was able to literally stand with a walker and try and walk. I was walking slowly, but I was out of bed. That was better.
What turned it?
I really don't even know. I mean, and then I tried CBD, which started to help me. I think it just from being in bed so long, my body started to recover just from rest in bed. And then the CBD, after like 2 years, when I started to try that from my PHC, who told me, let's try CBD.
Yeah. So the bottom line.
It's a lot of initials. What's a PHC?
Your primary care physician.
Okay.
Sorry about that.
It's like the NAACP.
My NBA.
Yeah.
And the NFL.
I learned a lot.
Yeah. Okay.
So here we are. So this is really important. This is why I thought when she agreed to come on this program, I was so excited because Julie's journey is so important because she, in many ways, is representative of so many obstacles that patients face. So here the issue is health and autoimmune disease. And so that's going to
big deal.
It's a massive deal. So bottom line is she gets better and everything's hunky-dory, right? And I'm so happy for her and all this. And then I get a knock on the door.
Uh-oh.
And she's coming back for one of her nose visits because she's really a good patient. And I ask people to come back for upwards of 10 years.
Do you really?
Yes, because if you do a nose and you care about the patient, you don't see them for 6 months and be like, call me if there's an issue. If you're really committed to your patients, noses, not breasts, not facelifts, but noses, you see them for 10 years. The reason being is that if you do the average rhinoplasty, somewhere in that 10 years, the nose is going to start going bad. And we've had many conversations about this because it starts to collapse and there's structural issues and da-da-da-da-da. So you want to know if you're doing good for these people. So if your nose is good for 2 years, but after year 3, it falls apart, then you're a shitty surgeon. You don't know that. It's not because you're a bad guy. You just don't know until you see them. So you really want to ask them to come back. Now, do most people come back? Not really, unless they have a problem. But she's awesome. And so she comes back and she comes in and she's like, my nose is great. I'm like, you look amazing.
Still great.
She was like, I feel great, Dr. Aban. I'm better. CBD's working. And I'm like, and then she's like, what did you ask me then?
What did I ask you after that?
Yeah. What did you say that you were considering and wanting to do?
Oh, my breasts.
Okay. So we're going to leave it at that.
Wow.
And we're going to talk about that when we come back.
We're going to take a break at the boobs?
Yeah, we're going to break. We're going to break at the boobs.
Make sure you come back.
And then come back, and I'm going to tell you how insanely amazing this story is.
Yes.
Well, please, thank you for listening to Plastic Surgery Uncensored. You've been hearing a segment with our guest, Julie, and her journey. And when we come back to Plastic Surgery Uncensored, we're actually going to hear the next step, which for me, after going through all of that, she's going back up to home. She's going to go up to the plate again. She's going to swing again. All right. Next up, boobs. You are listening to Plastic Surgery Uncensored with Dr. Aban on Revolver Podcast. On this segment of Plastic Surgery Uncensored, we are going to continue with Julie's journey. And this is the interesting part for me. We're getting to the boobs.
Okay, so we're back. And what for people who may have tuned in, whatever, we were talking about how you had to overcome this horrific flare of lupus that took probably in total from beginning to end several years, that got you bed bound and walker bound. And
wow.
You fought it, you got it over with. And most people would say, you just dodged a massive bullet, move on with your life. And how old are you at this point when this happened to you?
I was 60.
Okay, so you're 60, you got your nose done, you got this lupus thing. Call it a day and go home.
And you were already slim and cute.
Okay. But yet you came back, and tell me what was going on with your breasts, and let's talk about that.
Okay. So at that point, my breasts, first of all, they were too big for
You
my...
had done them when? What was this?
I had done them when I was 49, and they were too big.
You had them done why? So people are going to want to know, why'd you even have them done?
Okay, so I had them done because I was going to a lot of black tie events.
You had kids?
I had 4 children in a row.
Wow.
So, and I always felt, they were sagging. I just never got them done. I never had time running around with children.
How tall are you?
At the time, I was 5'5".
Okay, how much do you weigh and how much did you weigh?
At that time, I weighed 120 pounds.
How much do you weigh now?
105 pounds.
Okay, because it's important, right? People
Yes.
are listening.
She's
and they-
tiny.
So
Yes.
you're incredibly petite, always have been. Even when you had kids, you were always fit. You never gained weight. You always worked out. So it's very important because it's important for the background. So
Right.
you'd had all these kids. You decided to have breast surgery. You did your breast dog. You had saline breast dog at the time.
Yes.
And then you came to me and what was going on?
When I came to you, my breasts were encapsulated. They were too big, and I just
How
wanted
big were
them.
they?
They were a C plus.
Okay, so it's all relative. So
Right.
she was big for her frame.
Right.
Exactly.
And she was 60 and she's active. So what this talks about, which is really important, a lot of people make
She's under
deci-
125 pounds, too.
So a lot of people make decisions
Right.
at some point in their lives, and then later in their lives, the decisions they make don't apply to them anymore. So
Sure.
you're in your, let's say, late 40s. You've had several children. You're physically active. You want to still have a sexy lifestyle. You're going to black tie events, as you mentioned, and you have absolutely no breast tissue. So you have a breast augmentation, works great. Fast forward, now you're 60. You're in Lululemon all the time. Rather 63, and you're in Lululemon and you're working out and you're super fit, and you lost some weight because you're more lean. And now those breasts of yesterday no longer apply to you. So the question is, do you surrender because you're 63, or do you then make a modification so you can continue enjoying your lifestyle? And this is a big issue because a lot of people are like, well,
She still has
just-
pretty good sized Shimbolskis.
I'm 63. I shouldn't do this. But instead, you were like, you know what? 2 reasons. One is they're too big. You're every time I've seen you, you're in workout clothes, which is a lifestyle issue. She's always active. And the other is they're encapsulated. So what is encapsulation? It's hardening. They hardened. They became stiff, which we've talked about in the past, which is not a disease.
Talked about. You've done this because you got your boobs done. When you go to a consultation with Dr. Aban, because I've done it myself, there's some moving around, he lets you know, like, okay, this is going to be a problem. Like,
Right, because the thing is, you're going to get an implant. Your body's going to know it doesn't belong there. It's a foreign material, like a pacemaker, prosthetic knee, and it's fine. Your body will make a shell around it. That shell is a capsule.
you're very
It's totally
thorough.
normal. Everybody has it. All the women in the world have it. The issue is some women's bodies, their body, for no explainable reason, develops a thicker shell, a more voracious capsule,
Yeah.
which is then called capsular contracture. And what it does is it makes your breast firm, deformed shaped, usually moving upwards, and painful. And so the solution is one and only one thing. You need to remove that scar tissue and usually replace the implant, and you often don't make it again. So when you presented to me, that was what's going on. And what's really fascinating about this story, and I think it's really important, is at the time she was healthy. And so here are 2 issues that we need to talk about. Number one is, here she is, 63, just got over this huge medical problem, and she's considering having surgery. And are you crazy? And most people would have just resigned and lived unhappily.
not Julie.
And the second issue is we went from saline to silicone, which is a massively hot topic because she has autoimmune disease, lupus. And if you go and Google right now, there is the most massive controversy regarding autoimmune disease and silicone implants.
Really?
Oh yeah. From the very beginning, there is currently there's a whole explantation
Oh, I remember
movement.
that. I remember that.
Remember we had that conversation? The explantation movement is implants cause disease. And there is a huge movement of women who feel that they have brain fog, pain, joint disease, etc., which we said we're not going to substantiate or discredit. And when they have their implants removed, they feel amazing. So if that's the case, awesome. But here we have an individual who almost died of lupus, who's now forced by the nature of her pain to have a breast revision, and she's choosing silicone together.
and why was that?
Because, go ahead, why?
It begs the question.
I chose silicone because I was not happy with the saline. It felt very fake.
They're round.
It was really, really round.
They ripple.
It looked fake. It rippled.
They project a lot more, and they don't
Exactly.
feel natural,
No.
period. So we made a conscious decision. We talked about it. I told her the facts,
Right.
and she opted to proceed with a silicone revision. So what we did was we removed the capsule, check. We downsized her significantly, meaning it made the implant smaller. And obviously when you downsize, there's extra skin. And we did a lift. Where are you now?
Now I'm thrilled.
How far out are you?
We did it in December.
Oh, it's pretty new.
Yeah. But I feel amazing. There's hardly any scarring already. It looks
Wow.
fabulous.
Now, did she have, because of the
She
lift,
had-
did she had the
She had an anchor.
Yeah.
She had the whole shebang that everybody, she literally around the areola, down the breast, and in the crease. And we're on podcast, no one can see. But literally, it's been 8 months, whatever, it's 6, you can barely ever see anything.
Yes.
Wow.
Exactly.
But more importantly, two
That's
things.
impressive.
One, they're soft.
Yes.
Two, they have no discomfort. That was why she did this.
Right. I feel fabulous.
Well, they
I had
look very
so
good.
much pain. I was in so much pain. And after the surgery, I had no pain. I mean, it was such a little, I told Dr. Aban I took pain pills for 2 days. That was it.
So one of the
That
things
was
you had
the
mentioned to me was your post-operative nausea and experience, because you were worried that like you don't do well. You're frail. You're fragile. Look, you're a very soft woman. So these anesthetics in the past had caused you problems, right?
I always get deathly sick, not just nausea, but sick in pain. I wind up in bed in a lot of pain, feel sick for like a week or more after all surgeries.
Which you had like your thyroid. I mean, you had a whole bunch of things
I had so many surgeries. But with Dr. Aban, every surgery, I have no nausea. I'm not sick. I wake up after surgery feeling fabulous. And that's not a lie. This is the truth.
And the thing is, it's not because I'm some magician. It's the anesthesiologist. It wasn't me. It's because I work with the best anesthesiologist.
Exactly.
And when you go, oh, we had this everything we talk about today, we've talked about in the past, which is if
Right.
you're going to pick, oh, I love my doctor. He's amazing. Okay, awesome. Who's his co-pilot? What do you mean? Well, who's the anesthesiologist? I don't know. Well, what do you mean
matters.
you don't know? You don't know if it's a CRNA, an anesthesiologist, a board-certified anesthesiologist, it's a DO. Are they going to use propofol? You have crucified and scrutinized your surgeon, yet you have not a clue who the anesthesiologist is. It matters. Chipped teeth, vocal cord injury, nausea, vomiting, etc. So she had, and this is a credit to, in her instance, Dr. Houston, who's phenomenal, which, by the way,
Yes.
we should bring her on.
I would love
Yes.
that.
Oh, we should do a whole anesthesia. Anyways, I digress. So you did that, and you look amazing, and you feel great.
You wake up, you feel
and you
good.
and you think,
Yes.
okay, this is it, and this is good. You got out of Dodge, yet you came back for the third show,
Yes, I did.
which is astonishing in conversation. In that, what did you end up having? How long ago was it?
That was in April.
April.
April, I came back 6 weeks later.
It's 2 weeks. It was 2 months. You
2
just
months.
said 2
2
months
months.
ago.
Because- And here I
okay,
am.
so and what did you have done?
I had a body lift.
A body lift.
A body lift. And mind you,
What body?
all 105 pounds.
I was
of
going
it.
to say, what body? I could body lift you.
I did.
So what is that? Why on earth? Like, what are you talking about?
Now I'm curious.
Well, I did that because I work out, like Dr. Aban said, every day. So
do?
I was firm everywhere but my butt and my hips were sagging, and I could not stop them from sagging
And the reason is
because I have no more elasticity.
because you're 63.
Yes,
And
and that's
you,
what-
you can work the muscles, no problem. But the reality is your skin is 63 years skin. And you can get to a certain place, and there's nothing wrong with that. And the individuals who are listening, like, well, that's good enough. Great, good for you. But if there is a way and you are healthy, which by you, we've never operated on you when you weren't amazing. Always healthy, always active, better than when you are healthy and there's this option and you can do it safely, why the hell not? So what we did for her was a body lift.
I was just going to ask, is it the one where you go around the whole tree trunk?
That's exactly right. The
got the
circumferential
tree
body
trunk.
lift. So historically, we've talked about it, right? Why
I'm
do you
hanging
do
out with him a while.
Why do you do body lifts? So most people, when we have a conversation about body lift, it's after weight loss, right? And we have a patient coming up on one of our podcasts where she had a circumferential body lift and she lost almost 200 pounds.
Oh, my.
Right. And so that's the norm. I was 400 pounds. I weigh 170 pounds. I lost this weight, and the weight is everywhere. So we do a 360 and we remove a tremendous amount of skin and fat, and that's why we do it. In her instance, it's a different kind of body lift.
She doesn't have 200 ounces.
Right. It's a skin body lift. It's a tailored, super refined body lift. And the purpose of it was in order to take all of her hard work that she has earned and bring it to the surface. And by removing just the smallest amount of skin all the way around from beginning to end, we were able to lift her butt to where her muscle is. Now the tissue is there. We were allowed to tighten up her thighs, and she now looks outside the way she is inside.
Which is really good, Julie. Really.
Honestly.
If she wasn't so nice, I wouldn't like you. Because you're really...
And the thing is, people are going to not want to like her, but she's so...
adorable.
Goddamn sweet.
She is. I'm going to go with you on that.
And so that brings the last issue. And I know one of the things is, I know that on top of this, so again, why is she an amazing journey? She dealt with serious medical condition, which most people would have just thrown in the towel. Like, I have diabetes and whatever. No, she got better. And if you have a medical condition and you are healthy in that medical condition, I have blood pressure issues. Okay, is it controlled? Oh yeah, it's really well controlled. Awesome. I'm a diabetic. Well, is it controlled? Yes, we have a patient who wanted a facelift. Her diabetes was out of control. We canceled her. Of course we canceled her. We told her to come back in a year whenever it's controlled. But when it's controlled, it's controlled. So just because you have a medical condition doesn't knock you out of the park. And we've talked about that. The second thing is this idea that I'm too old. Like, I'm just too old for this. Like, I'm 63, 72, whatever. We know that's nonsense.
Right.
And the last thing is that you were going through, at the time, a separation.
Exactly, right.
And I think that is so important to talk about.
It's traumatic.
Because of the psychology of separation and the impact on self-esteem and the impact on going back out there, whether you intend it or not, to find another partner in life. You don't know what life holds, but the idea that I'm going to go out there and I'm going to go out there 110%. So can you share a little about that sort of psychology as the background? I mean, you did it for the reasons we talked about, but at the end of the day, we can't deny the fact that that was looming in the background.
Right. I'm sure it was looming in the background somewhere in my mind. But like at this point, I'm not thinking of, I want to go out, I want to find someone. But I also am thinking, I want to feel good. You know, why can't we feel good for ourselves?
100%.
It doesn't have to be, I want to look good for this one. I want to feel good. And I work out all the time for me. It makes me feel good. It keeps me healthy. It keeps my lupus in check.
It does.
And it keeps everything else in check. At this age, you have to keep yourself in check.
How many years
you want to be
married?
healthy. I was married 40 years. Wow. 40 years.
Yeah. And the issue is not about, we're not talking about... Go ahead.
Right. No, I'm sorry. And I think women should not always think, I have to look good for a man. I have to look good. Look good for you. Feel good about yourself.
Amen.
If you get a divorce, it's not the end of the world. You have yourself, you know?
And that's why I bring this topic up. Not because divorce, like she needs to go out there and find another man. They'd be lucky if anyone were to connect with her again. It's because she was getting divorced. She didn't just lay down and say, well, I'm 63 and I will whatever. She said, great, I'm 63. I have this medical condition. It's under wraps and I want to look badass. Well, and you know what?
She does.
And good for her.
She does.
No, but most people, when they're in the middle of this separation, it really affects their ego in a way that actually they often surrender.
Well, that's why I asked how many years, because I don't care what anybody says. 40 years and 4 children has to be way more traumatic than 5 years and no children.
Of course.
Way more. There's
but I give her mad
ties.
props. And I think that she epitomizes and embodies the ideal, well-balanced, well-adjusted female.
What's
and
next?
That she has it all kind of packaged in the right amount, not ashamed to talk that I did surgery, did it all for good reasons, never went overboard with any of them, and loves herself. I think that's amazing.
Yay, Julie.
Yeah.
Thank you. Well, life goes on. That's what I say. Never stop.
Never
Keep going and think positive.
Yeah, the podcast will continue as well. And we will have more episodes for people to hear.
Yes, we will. But for today, thank you for listening to Plastic Surgery Uncensored. Please continue to check back in with Dr. Aban and myself, Monique Marvez. We will always have exciting things to talk about and people like Julie.
Yes, and don't forget to tell everyone you know to download and listen to our podcast.
We would love to get your feedback. If you enjoyed and found our podcast helpful, tell us why. Give us the review and subscribe on your favorite podcast platform. We can be found on Apple Podcasts, Google Podcasts, Spotify, iHeart, or you can go directly to revolverpodcast.com. If you have a topic you would like us to talk about, then please reach out to us on Facebook, Roddy Raban, Instagram at Dr. Roddy Raban, or roddyraban.com. You are listening to Plastic Surgery Uncensored with Dr. Roddy Raban on Revolver Podcast.